In this video, I'm going to show you how to quickly self-assess your spinal mobility so you know whether your spine is a weakest link that you need to start training. Before we're doing any of these movements, I want you to be aware if you have any pain or major discomfort with any of them, just know that's an automatic fail for that test and know that this is automatically a weakest link that you should be working on. So I got Sheridan here to help model these movements. The first thing we're going to be looking at is our spinal flexion or reaching for the ground. So for this one, Sheridan, I'm going to have you face me, and then keeping knees straight, you're just going to reach towards your toes as far as you can. And she's so close, maybe 3-4 inches from touching the ground, but we can tell spinal flexion might be something that we want to train with our mobility. Next, we're going to be looking at lateral flexion or side bending. So we're going to face straight here, and you're going to glue your hands to your sides, and you're just going to, almost like a penguin, you're going to slowly reach down and see if you can touch your knee. So on this left side, nice, she can reach that without breaking too much plane. Right side looks a little bit stiffer, but she reaches it. That's a pass. Maybe we got to work on some lateral flexion, but at least it's not egregious, huh? No, I'm just messing with you. After lateral flexion, we're going to test our rotation. So this is where a lot of you actually might see your biggest limitations. So for this one, I'm going to have you actually face me, feet all the way together, and you're going to bring your hands out straight in front of you, and I just want you looking at your thumbs, and you're just going to rotate towards the camera as far as you can. Nice, and we want to reach 90 degrees. So she's right at that or just a smidge past it, so that's a nice passing grade. Now we're going to do the same thing on the other side. So when you're ready, go ahead and rotate towards. Nice, actually more mobile on this side. So we're seeing a little bit of weak links. Nothing crazy though. I would say she's been passing everything but her toe touch, which we'll work on. Now with rotation, we're going to break that down further because this is what we would call multi-segmental rotation. So it's working on hip rotation along with spine. We're going to break it down to just the thoracic spine. So for this one, I'm going to have Sheridan take a seat, and we're going to just fold arms in front of us. And for this, you're going to look at your elbow. So let's test our left side. You're going to stay looking at your elbow as you try to bring that elbow and rotate. And what we're looking for is 45 degrees. She's at about close to 60, so she definitely passes this side. And then let's do the same thing on the right side here. Nice. So a little bit sticky at that end range, but she passes this test too. So again, you're looking for 45 degrees there. And when you're doing these tests, make sure you film yourself or you have a partner nearby so you can really break down your movements and where your weakest links are. If you failed a lot of these tests or you had pain or discomfort, then you know spinal mobility is something you should train, and you should check out my spinal mobility programs within the membership.